The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. We'll get started in just a minute. Okay, I think we can go ahead and get started. Hello, everyone. I am Caroline Williams from Benefit Advisors Network, here to welcome you to our webinar. Today, we'll hear from a panel of experts on next steps in workforce dynamics in reference to COVID-19. Today's panelists are Stacy Barrow, BAN's Compliance and Legal Director, Bobby Kloss, BAN's Director of Human Capital Management Services, Benefits Consultant Diana Gaking, Director of Strategic HR Services, Karen Tierney, and our moderator and Human Resources Consultant, Shannon Euchre. Before we begin, we are required by law to advise you that this webinar is being recorded. If you don't want to participate in a recorded event, please disconnect yourself from this call. Today's presentation materials can be downloaded from the handouts section of the GoToWebinar panel on your screen. Since this meeting is being viewed by hundreds of people across the U.S., all callers are on mute. Please post your questions in the chat feature and we will answer them at the end of the presentation. With all that said, let's go ahead and get started. Shannon, would you like to begin?
Thank you, Carolyn. Appreciate the introduction. Thank you again and welcome everybody to our Human Capital Management Services webinar. Our HCM Return to Work Subcommittee has been hard at work creating tools and guidelines that will help employers and BAM members while they transition back to the work site. We have a very detailed toolkit that we'll be sharing at the end of the webinar, and it'll be sent out to the individuals who have attended. We've done a lot of the heavy lifting and created the templates and sample communications for BAN members, as I've mentioned, and we hope that they'll assist you as you're working with groups or the companies that are doing that transition to the work site. As Carolyn mentioned, my name is Shannon Euchre, and I have had the privilege of working with the Human Capital Management team to create this toolkit and guide for everyone. I will be the moderator, and I will be monitoring the questions and comments in the chat as we go through the presentation, where we'll have a question and answer at the end as time allows. Any questions that we do not get to, we will have a FAQ that we will be sending out to all participants with the answers to your questions as they go along. What I'm going to be going over today is basically the objectives of the webinar and the contributors to the webinar, as well as the agenda. As Carolyn mentioned, we have a large panelist group here that has a lot of experience. But to start off with the objectives, basically what we want to do is guide you through navigating the next steps to retooling your workforce dynamics. What that entails is that we know that in the current coronavirus pandemic, it has interrupted the business operations really across the country. While it's really unclear as to how long the COVID-19 will continue to affect our organizations, employers are in various stages. As we know, states are opening up differently and have different models as they open. And the business operations are changing, and they're going from either a temporary shutdown to employees working from physical offsites, or contemplating a return to remote employees, or even to having employees stay remote, finding that that is something that's being efficient and is working for them, and they are considering telecommuting as an option. We are going to be discussing what we consider phase one, and that is, what does return to the work site look like? So the objectives of this webinar are to discuss navigating the next steps in retooling the workplace dynamics, as I mentioned, as the shutdown lessens or stops. We, like I said, we know that states are in different phases as they go through this, and this guide that we created and the toolkit will help any organization, no matter what stage they are in, if they're just thinking about coming back to the work site, or if they're in the middle, or if they're full on. It'll be a great resource for organizations to use and to look back. And we'll have sample letters and sample checklists and things like that that we'll go over as well in regards to those portions. Our contributors, as you can see here on the screen, we will start off with Stacey Barrow. As Carolyn mentioned, he is the compliance director for BAN. He's one of the nation's leading experts on the HCM. He does use a practical, business-focused approach to counseling his clients in matters related to employee benefits. He is going to be talking about those things that are on the horizon that have had some amendments that everybody should be aware of. Bobby Kloss, the Director of Human Capital Management Services, and she's really been our project manager for this project that we have worked on as a team. She has 20 years of HR experience in generalist and executive level HCM management. She does have a deep understanding of the complex and diverse HR industry that we all work in. She does provide expertise to employee benefit brokers as well as their employers and clients. And many of you may have worked with Bobby on HR issues as well. Diana Gaking, a benefit consultant. She has a concentration on health and welfare compliance and continues to sharpen her focus by serving on the National Human Capital Management Committee, as well as the National Compliance Committee for BAN. And she is an active member of the SHRM organization. She's been invited to speak very locally and nationally on ACA and compliance and best practices. She does hold her life and accident and health license through Ohio, and she does have her PHR through HRCI and is a certified HR professional through SHRM. Karen Tierney, Director of HR Strategic HR Services, has 20 years of experience as an HR specialist, journalist, and strategic business partner. She does regularly conduct trainings in organizations and leadership and development, including manage difficult conversations, EI, coaching to improve employee performance. She has a BA in political science, master's in public administration, and a master's in education and counseling from the University of New Hampshire. And like I said, my name is Shannon Euchre, your moderator, HR resource consultant. I have 10 years of HR generalist experience in several industries, including construction, federal contracting, healthcare. As a consultant, I help employer groups who conduct HR audits, review policy procedures, employee handbooks, and help coach groups. I hold my North Dakota Life and Accident Health license. I also have a PHR through HRCI and my SHRM CP certification. The agenda for today's meeting is to go over benefits consideration for COVID-19. Like I said, reworking your work dynamics to the work site, talking about the pandemic information for employees, sample communicable and infectious disease policies. These are ones that we created and can be used by employer groups and self-branded. Like I said, we did the heavy lifting for you. FFCRA, emergency leave of absence. This is going to be a review of many of the things that have been changing through the COVID-19 pandemic, but some very important information to keep in mind. And then a bulk of the time is going to be spent on the return to work site and then discussing some of those things of the checklist that we've created as well. Then there will be the questions and comments section at the end, where we will gather all our questions and we'll answer as many as we can. Like Carolyn said, you can enter them in the chat section and we will monitor them as we go forward. One thing to keep in mind is we've prepared a employer resource guide. Basically, it covers the COVID next steps to workplace dynamics. And we'll continue to update this as the ever-changing environment that we currently live in, and we'll make adjustments as we deem necessary. To get our guide, we ask that you contact the benefit advisor who invited you to this webinar and ask for the document called Band 638. It's called Band 638, and any other COVID-19 resources. You can also find this at the link down below in regards to getting the information. It's a very all-encompassing document, and it will have all the sample letters and the checklist then as well. So with that being said, I'm going to hand the baton over to Stacy, and he will begin the portion on the benefit plan consideration.
Great. Well, thanks, Shannon, and thanks to everybody for joining. I'm going to start with some benefit plan considerations as employers and employees continue to deal with the COVID-19 pandemic, and I wanted to focus on a few recent pieces of regulatory guidance from the agencies that have oversight over the health and welfare plans, and that starts with a disaster relief notice that was released by EBSA, the Employee Benefit Security Administration, and they're part of the Department of Labor. And they've provided some relief to employers here, essentially relieving them from penalties related to any notices or documents that are required to be furnished during the and that is the period of March 1st of 2020 until 60 days after the announced end of the COVID-19 national emergency. So an additional 60 days after the announced end will be the end of the outbreak period, and then the regular time frames are going to continue to apply. And this relief extends to COBRA notices, SPDs, summaries of benefits and coverage. You do need to be cautious as an employer. You want to act in good faith and furnish documents as soon as practicable. And really, if employees are requesting documents, you want to provide them ASAP. These timeframes are really more of a safe harbor from regulatory enforcement. And so also to that end, the Department of Labor issued a final rule providing relief to participants and beneficiaries, allowing them some additional time to be able to be more informed about making health insurance elections and reporting COBRA events and things like that. And so this also applies during the outbreak period. And so this is from March 1st until 60 days after the end of the COVID-19 national emergency, or some other date that's announced by the agencies. They've indicated that there may be some regional issues where certain regions that are harder hit may have a longer outbreak period, and so the delays in those regions would extend past the national one. So the way that it's going to work is that the deadline for requesting certain changes related to health benefits, notifying the plan of COBRA events, making COBRA premium payments, those deadlines are going to be paused essentially during the outbreak period. This does not mean that we have to pay for COBRA coverage. I'll speak about that in a second separately. This is really just for the notice period. So if an employee has a child or gets married or loses other coverage, those are HIPAA special enrollment events, and their regular 30-day period is going to be extended until after the end of the outbreak period. Same thing with the COBRA election window. That'll also be paused until after the end of the outbreak period, and the deadline for making COBRA payments And again, employers don't have to pay COBRA premiums for employees under these rules. It merely extends the deadline for employees to pay that they will eventually have to pay if they want the coverage retroactive. Now, before I move on, there is a piece of legislation. You've probably heard of the fourth phase of the federal legislative relief bill that has been introduced. I think it was introduced yesterday, actually. That has a subsidized COBRA piece in it, where the federal government will be subsidizing up to 9 months of COBRA at 100% for employees who are furloughed or on COBRA. This has just been introduced. This is not law yet, but it is going to, from what we see now, it is currently part of the package in the fourth phase of relief. This is not unexpected. We're fully expecting some kind of a COBRA subsidy. And so when you consider that, it'll be the employers paying the premiums and then getting tax credits on the back end. Some of these deadline extensions make more sense, where the federal government's going to basically be covering COBRA premiums for a period of months. And we anticipate the way this is going to work is that it will apply not only to people on COBRA, but employees who were furloughed and the employer continued their coverage. They will get the same type of tax credit. So this should be a lot of relief in the next bill coming up. So keep that in mind when you're thinking about these deadline extensions. And then lastly, on this slide, Bobby, I think, is going to be covering this, or maybe Diana, in a few minutes. The FFCRA leave programs, the emergency paid sick leave and expanded FMLA, they continue to apply through the end of 2020. And so, obviously employees, hopefully not en masse, but employees on an individual basis may continue to need this paid leave in connection with COVID-19. And we'll tell you all about that in a few more minutes. Most recent news is these two IRS notices that were released a couple of days ago, and they affect mainly cafeteria plans and health and dependent care FSAs. One of the items of relief here, and these are all voluntary, the ones I'm going to talk about now. These are voluntary for plans to adopt if they want to. I'll explain the adoption procedures in a second, but this is not mandatory. But if a plan wanted to, they can extend their deadline to incur FSA claims, whether it's health or dependent care FSA claims, for any 2020. So this is really more for non-calendar year plans or calendar year plans from 2019 with a grace period that ended in 2020. You can allow employees, say the plan year ended March 31st or ends June 30th or ends September 30th of 2020. These employees will have until the end of 2020 to incur claims. It's like an extended grace period, a relaxation of the use it or lose it rule. And then another bit of relief, and this is in response to, to a number of issues, but one reason I think the IRS provided this relief is they're responding to the insurance companies who are providing these opportunities for employees to enroll mid-year without a real change in status event, just basically due to COVID-19. And so the IRS here is saying for any mid-year election change that is made during calendar year 2020, an employer can allow employees to either enroll in the plan if they'd waived previously, they can change benefit options, or they can drop coverage, and all this is prospectively, as long as the employee is attesting in writing that they're enrolling in other health plan coverage. So that kind of takes care of the health insurance piece. And then for the FSAs, you can allow employees to make a new election or increase or decrease an existing election only on a prospective basis. So it doesn't mean you can kind of allow people to rescind or revoke their election retroactive to the beginning of the plan year. But if someone came in today and said, I'd like to stop my health FSA election, you could allow them without proof of a qualifying event. And of course, the plan will have some constraints around this. The plan does not need to allow an employee to reduce their election below an amount they've already spent. So the employer will not have to cover that difference. And then another change here is the carryover amount that's available under health FSA is now going to be indexed. It's 20% of the maximum salary reduction amount, and 20% is coincidentally how they arrived at the $500 figure initially. When the limit was $2,500, they figured a 20% rollover would be fair. That was $500, and so now they're just going to index it as the limit increases, so will the rollover limit. Now, to avail yourself of this relief as an employer and allow your employees to take advantage of it, you do have to amend your plan. You have time, and you have until the end of next year to amend it. It can be amended on or before December 31st of 2021, and it can be retroactive back to the beginning of this year. So many of this relief for making election changes, FSA changes, it doesn't have to be weaved into the plan immediately for you to take advantage of it. And then lastly, there's a trend that we've noticed from some insurance carriers. In our experience, it's mostly been dental carriers that are providing premium credits to employers in recognition that employees can't really receive routine dental care at the moment. And so these can be significant. We've seen, something, 50–60% of a monthly premium in some cases, and as a total refund. And so, in general, as an employer, when you receive these credits from the insurance company, you have to, at least initially, treat them like medical loss ratio rebates. Review the terms of your plan and see what the plan says about refunds. If this is 100% employee paid benefit, you're generally going to have to, use the funds in a way that complies with ERISA, like returning them or offering a premium holiday going forward, assuming they're ERISA plans. And then otherwise, take a look at the terms of your plan. Many plans are drafted to allow employers to retain these types of refunds. But if the plan terms are silent, then again, you may need to look to what you've done for the MLR rebates and share the refund with employees proportionate to their contributions. Well, thank you. Now turn it back to Shannon.
Thank you, Stacy. Appreciate that. Next, we'll have Bobby. She'll be going over the next sections of our presentation.
Thank you, Shannon. So now we are seeing that COVID-19 and the national, statewide, local responses have caused organizations to readjust their workforce dynamics during these critical and often very confusing times. I know many times we can feel like we've taken 10 steps forward and then several steps backward. But as a strategic planner, the human capital management professional has played a critical role in guiding and directing the C-suites of the organization through this maze of information, directives, and at times even contradictory information. In being responsive as we move through each phase of COVID-19 challenges, I believe it's imperative that businesses have an effective and strategic preparedness plan. It's even more important that once it's drafted, it doesn't just go into a file, but that it's referred to, it's kept updated, and it becomes, a piece of your right hand. It's always there. This plan should bring together, but most importantly, keep together the team of your members from each level of your organization so that your business doesn't miss a beat as they receive and implement on critical communication, whether it comes from the employees or it comes from federal and state guidance. Shannon, if you can go to the next slide, please. So your plan should always be prepared by first and foremost keeping in mind the safety and well-being of your workforce, as well as communication between the C-suite and its employees. Additionally, as the landscape is continuously changing, you want to be able to be sure that you're taking into consideration all of your interested parties, not only your employees, but your supply chain, the public, your customers. And third, as businesses have had to move to remote working conditions, it's continuing to be imperative that technology is secured and protected. This is definitely not an area where you can afford a business risk. In keeping your employees safeguarded, and Karen will go into more detail further in the presentation, but it's about knowing and understanding the requirements that are published and updated by the Centers for Disease Control, or CDC, but what's also happening in your local areas. And we see those changing, and we see sometimes that, again, they go forward and then they go back. So having your pulse on, where to get this critical information is important. And then as your employees travel, you're also going to need to keep abreast of not only what's happening where they are going and following, but also what your customers are requiring. The next slide, Shannon. Thank you. Your pandemic strategy is, again, a living document and should be built strategically to not only provide you with your organizational strategy for COVID-19, but it's about thinking big picture. How does your organization respond to other national disasters, other epidemic situations? I think one thing we're learning here is that we need to be prepared. Because this has caught employers off guarded, and we need to be able now to take this information and long-term think about how we prepare and plan. So many of you are already familiar with our infectious and communicable disease policy, which we developed and rolled out in March. We've taken that resource guide, we've expanded your resources to our COVID-19 next steps in workforce dynamics. This includes not only the pandemic information for helping you draft your comprehensive and your strategic plan, but we've included guidance from OSHA, the CDC, employee benefits, risk management, as well as the considerations from your human capital management colleagues. We try to walk you through each of the impact areas that affect your organization. And recognizing that each organization is not at the same place as another, your best practices are going to be those that come from any industry guidelines, as well as your own organizational needs. So considerations on planning on the impact of your business, not only for today, but it's going to be needed and necessary to model and forecast out your different scenarios for different impact and revenue models. You also want to be planning for the impact on your employees and your customers. Will your employees be able to work? Will customers be able to be supported? Will customers be maintained? And then you need to establish your policies that are to be implemented, and we're going to review the impact of the policy components next. And then as you allocate your resources to protect your employees and customers, businesses are always having to determine where best to deploy their capital. Typically in the human capital management world, you're looking at technology, you're looking at benefits, you're looking at employee relations, you're looking at your pensions. And again, this forecasting not only needs to include the capital, but also manpower is going to need to be modeled under these different scenarios. Communicating with your employees and customers, people fear what they don't know. So it's going to be important that if we keep them in the know, we can help lower their fear, we can help reduce stress levels. And not only does that happen with our employees, but it also needs to occur with our customers. So keeping employees, keeping customers engaged in the know is going to produce these long-term positive results for your organization. And then coordinating with external organizations and helping your community. We need to be talking to our building managers. We need to be talking to other tenants in the building. How are we cooperating? How are we communicating with them? How can your company continue to maintain a strong brand name within your community by pulling together? Again, you have the ability to produce long-term positive results for your organization. So we provided additional support in the post-COVID-19 timeline included in our resource guide for reopening your worksite. This timeline should not be a rush back to reopen any closed doors or sending employees off traveling or even bringing remote workers back to the workforce. It's going to be important that you draft out each of your tasks to consider. You consider your timing for implementing. We need to recognize that some resources for things such as face masks, sanitizers, those things may not be readily available, and we need to have those available in the work site when we bring employees back. Yet, we also need to keep in mind first the safety and well-being of your employees. And I know Diana and Karen both are going to talk more about that as well. So, I'm going to also suggest your trusted advisors also has resources available for those who need assistance in planning, preparing, and maintaining your guide. Your trusted advisor who invited you here today is part of your team and is here and able to help you work through these strategy decisions. Shannon, if you could go to the next slide. So in drafting and developing your policies to support your pandemic responsiveness plan, we've also provided in the resource guide a template policy that covers these key components. So communicable diseases. Again, this should not just be about COVID-19 today, but we believe strategic planning is needed. We are here where we are today, but tomorrow, who knows where we will be? What if there's another surge in transmission? What if another pandemic occurs? It's going to be important that all models for potential impacts on the business need to be role played out. Equal employment opportunity. Diana's going to go into details on the leave of absence and how EEO and Americans with Disabilities Act is also affected. But your policies need to take into consideration what is already existing guidelines and those that continue to be drafted and implemented. As we look at privacy, protecting your businesses, your customers, and your employees' information is always a threat. We have new threats now, though. If you have employees working from home, how is your company interest being protected through their internet connections? I think we all have heard about Zoom and some of the things that are happening there. And, so unfortunately, there's always somebody looking to take advantage and looking for these windows of opportunities. And so these are areas with our technology that we really need to be very thorough in ensuring protection. And then preventing the spread of infection. We published on a previous slide some of the guidelines issued today. Karen's going to definitely go into more detail. But again, I cannot emphasize strongly enough, to the best of our ability, we need to keep our greatest asset, which is the employees, safeguarded. Our policy components look at attendance. COVID-19 has definitely presented new challenges in an employee's ability to be fully present at work. Many of us have had to explore the nuances of closure of schools, daycares, summer programs. We're kind of on edge looking to see what's going to be happening there. And these all have employers rewriting attendance policies to allow for greater flexibility in how employees work and their schedule of work. Again, Diana's going to really go more in depth in reviewing the LOA policies, but suffice it to say, FFCRA was developed to provide guidance, to provide safety, to provide monetary protection for both employees and employers who are faced with attendance challenges. Another component to look at is your business travel. just mentioned it briefly before, but this is a consideration needed for keeping our employees safe, but also our customers and the public. Travel guidelines look differently state by state, and they may also as well as you go from customer to customer. So it's going to be important that you have a plan and a policy for your employees to follow as they go through, as well as testing for, returning from travel locations. There's still hot spots out there. There are new ones that arise. So again, having to keep in that forefront what is happening across the different states, as well as your customer sites. And social distance guidelines. So businesses are going to need to ensure that, again, following state guidelines, they need to communicate this plan to employees. We also need to remember that this is new behavior, and new behavior has to be learned. And in order to learn new behavior, you have to take time to practice. I sometimes hear of, people getting frustrated that, hey, we're supposed to keep social distancing or keep our mask on, but yet here they are face to face with me. Or, they wanted to reach out and shake my hand. It's going to be that muscle memory that's going to create this new behavior to happen. But the more as an employer that you can communicate, that you can publish, that you can encourage your employees to maintain your guidelines, no matter what their personal opinions may be, they're going to follow the guidance of that leader. So repetition is definitely going to be needed in that. So I'm going to turn it back over to you, Shannon, to move forward. Thank you.
Thank you, Bobby. Next, we will be having Diana talk about the FFCRA and the background behind that.
Thank you, Shannon. As part of the Family First Coronavirus Response Act, there are new leave of absence requirements in place, and specifically emergency paid sick leave and emergency expanded family medical leave, EFMLA and EPL. There is some overlap between the two policies, but they are different. There are differences between them. So we will go into a little bit of that in the next couple of slides. But it's important to just know within your company, we have tools available that you'll get in the guide that will help you put these policies in place if you don't already have something in place. Regarding both the emergency paid leave and the emergency FMLA, in order to be an applicable employer, this is going to apply to private employers with 500 or fewer employees. There are exceptions to that, one being if you're a healthcare worker, and a potential exception if you are a private employer with fewer than 50 employees and the viability of your business would be a concern in providing the paid emergency leave or the emergency FMLA. One footnote I do have in here is that the emergency FMLA, the expansion to the FMLA, it really is an expansion and not a replacement. So original FMLA continues to apply to all public sector and private employers with 50 or more employees. So again, this really expands on it, it doesn't replace it. In regard to both the Emergency Paid Sick Leave Act and the Emergency Family Medical Leave Expansion Act, there are some criteria for the employee in order to get the paid leave. Number one, the employer must have work for the employee. So for example, if you're an employee, you work for a cafe and your cafe happens to be closed, it doesn't really matter why, whether it was governor orders or whether the business didn't stay open, that would be an unemployment type situation. That wouldn't be paid sick leave or paid FMLA. Regarding the family medical leave, there has to be a qualifying reason, which we'll go into a little bit more, and the employer and employee have to agree on the work schedule if it's not a full leave of absence and it's a partial leave of absence. You can go ahead, Shannon. Thank you. So in regard to specifically the emergency paid leave, the emergency paid leave is going to come into play when the employee cannot work on-site or remote because of the following. The employee has been diagnosed with COVID-19 or the employee is under quarantine for COVID-19 symptoms. I know when this was initially rolled out, there were some questions on the availability of testing, so that's probably why there's, that diagnosis isn't a must. It also encompasses the under quarantine for symptoms. The second reason for this, the employee is caring for a family member who has been diagnosed with COVID-19 or is under a quarantine for symptoms. And then the third would be if the employee is providing childcare for a minor whose school or daycare is closed because of COVID-19. And then again, specific to the emergency paid leave, there is a maximum benefit of 80 hours. So going back to kind of the reasons behind this, if your employee is requesting emergency paid leave under the number one, that they have COVID-19 or are being quarantined for symptoms, they're going to get 100% of their pre-leave income for up to 80 hours. If they're under quarantine to care for someone else with COVID-19 or to care for a minor whose school or daycare is closed, they're going to be eligible for 60% of their pre-leave income under that circumstance. And then in regard to the emergency FMLA, just to back up a second, the purpose of traditional FMLA was really to allow employees a reasonable amount of unpaid leave for medical and family reasons. And the focus behind traditional FMLA has always been job protection. What the emergency FMLA or the expanded FMLA has really introduced is being paid for this leave of absence to care for children. And so again, this is an expansion of the FMLA. You're still going to have job protection for the employees who qualify for the leave. They're going to be able to remain on your health insurance for up to the 12 weeks of your leave. What's new is they're going to get this 66.7% of pre-leave income to a maximum of $200 a day or $10,000 total from the 11th day of leave to the end of the 12 weeks. And then just kind of on that note, you don't have to go back, Shannon, but on that note, one thing to note is there is an expiration date on the expanded FMLA. It is through the end of 2020. So just a note on that. And then this chart on this slide is a helpful tool to really kind of see how the emergency paid leave and the emergency FMLA work together. So the emergency paid leave, again, that's up to 80 hours. So that's going to be day 1 through day 10 of being on leave of absence under the qualifying reasons. So if the employee is diagnosed with COVID-19 or is under quarantine for symptoms, they're going to be getting between day 1 and day 10, 100% of their pay. If the employee is caring for a family member who has been diagnosed with COVID-19 or under quarantine for symptoms, they are going to, between day 1 and day 10, get 67% of their pre-leave income. Now, for number 3, if an employee is providing childcare for a minor whose school or daycare is closed because of COVID-19, they're going to get 67% of their pre-leave income day 1 through day 10. Now, if the employee has worked for 30 more days and cannot work on site or at home, and they continue to care for that child beyond that day 10, they are going to be eligible for the emergency family medical leave, and that's going to be through day 10 through up to 12 weeks, where they'll be getting their job protection, they can remain on the benefits, and they're going to continue at that 66.7% of their income. For those of you who currently employ 50 or more employees and are subject to traditional family medical leave, you're probably already aware of poster requirements under FMLA. With the Family First Coronavirus Response Act, the Department of Labor has released notice guidelines that employers also need to post employer rights notice on paid sick leave and the expanded FMLA. So you can get a copy of the notice from the Department of Labor website or by following the link if you download the slides. This notice is to be posted at your worksite location with employers currently partially working remote, working on site, maybe a blend of the two. What I've really been giving as guidance is if you have people working remotely, go ahead and send it to them in the email, and as soon as feasibly possible, get that posted at your work site. And then, of course, with any type of regulations, there is going to be some record keeping. Luckily, it isn't too extensive, but you will want to keep track of anyone on the employee paid leave or the emergency FMLA. You're going to want the employee's name. You're going to want the date or dates for which they have requested leave, a statement of the reason why they are requesting leave, and then a statement that the employee is unable to telework. There are tax credits available for employers who are subject to employee paid leave and the expanded FMLA. In order to get the tax credits, you're going to need the record keeping that I just talked about. And these are going to be available for the wages that you've paid, along with any qualified health expenses, along with the employer's share of Medicare tax, for the period of April 1st through December 31st. So just a little footnote here, anytime we're dealing with the IRS and we're dealing with tax credits, if you have any questions calculating that, you're definitely going to want to talk to your legal counsel or your tax or financial advisor. So Shannon, I will turn it back over to you and just remind anyone, I know that was kind of a high level overview, so if there is anything that you would like expanded, feel welcome to ask a question and we'll go through those at the end.
Thank you, Diana. All great information. Now we're going to turn it over to Karen, and she's going to talk about the return to work site considerations. This is a tool that we worked on as a group to help assist employers as they look at changing the worksite dynamics. So with that, go ahead, Karen.
Thanks so much, Shannon. So as stay-at-home orders are lifted, our organizations are making decisions about if, how, and when to return our employees to our work sites. And while some essential business operations have continued with on-site operations throughout this initial stay-at-home period of this COVID crisis, my focus today is really on the organizations who have previously made the decision to suspend those on-site operations or have employees who have transitioned to working remotely or who have even been had to furlough some employees. So what's clear is that there is no one single approach that'll work for all of our organizations. As employers are making decisions about what this next phase of the pandemic means for our organizations and for our employees, health and safety risks are top of mind. We also continue to navigate and understand all the different various local, state, federal, and industry-specific guidance and regulations as we balance our business needs and also our needs of our employees. And so while we're going to provide a fairly high-level overview of this return to work information and considerations, we also just wanted to make sure that you're aware that there'll be an OSHA-specific risk management webinar provided by BAN on Thursday the 21st with Jade Simmers presenting on a more in-depth review of the safety and health concerns for the work site specific to the COVID crisis. So part of the decision making for returning to the work site includes deciding who should return with social distance guidelines, additional cleaning, and efforts to reduce potential exposure for our employees. Some organizations are keeping portions of their workforce off-site and maintaining those remote work arrangements. But if it's decided to return employees to the work site, when and how will that be managed? Will you be staggering shifts? Will employee work locations be spaced apart differently? There are a number of different considerations. So thinking about how will safe and health precautions be managed, by whom, and how you can communicate these decisions to your employees are very important. So with these questions in mind, the tool that is now available, the BAN 638 Guide to Reopening, it provides a sample work site readiness survey for employees. So the survey can be used to collect information about employee concerns, and that can help guide your decision-making about when and how you're returning employees to the worksite. And it can also help with identifying those questions that employees have and that they want to have answered by organizational leaders. Another tool in the guide that I'm going to focus on now is the 6-step plan to workplace reentry. And this is really a helpful checklist when considering transitioning employees back to the worksite. So the first part of the checklist is focused on preparing the building. So thinking about the applicable health and safety issues that are specific to the organization. Will your employees need masks? Is the organization providing the masks? Will you be taking employee temperatures before they enter the building? If so, who is going to be responsible for taking temperatures? How will that be done? How will you ensure privacy and confidentiality? Do you need additional supplies? Maybe for cleaning, for even just in terms of being able to take temperatures, how are you going to do that? And how are you making sure that roles and responsibilities are clear for all of your employees? The next focus of the checklist is on preparing the workforce. So consider obviously using that survey to ask your employees for feedback, and also consider how will you address the concerns that are raised by the employees. Who is going to be staying remote? Who is going to be returning to the work site? Will the office setup be changed? Will employees be expected to stagger times? And additionally, what are the new expectations around policies on business travel, visitors to the work site, and etc.? The next part of the checklist focuses on controlling access, which is going to be a challenge for a lot of our organization. What does that reception area or lobby now look like? What is expected of any reception area staff? How will social distancing be implemented? Will you add plexiglass barriers? What are required in terms of masks? Will you need new signage for the reception area, such as floor markers? If you are screening for temperatures, who, how, when, where will, and what is the protocol for this? Do you need additional supplies? And for instance, are you going to provide additional hand sanitizer? And who's in charge of keeping that filled? The next piece is focusing on creating the social distancing plan. So again, we've talked about staggering shifts or start times and end times for employees, but also thinking about how do we serve our customers and clients effectively given these changes? What will it look like to meet with our clients and customers? How will those interactions change? Do we need to know how to use conference room space or break rooms? Who can use these spaces? When? Can everyone use them anytime, or are there going to be staggered access points and timeframes? And another point that we're thinking about is reducing touch points. So who and how will we cover these enhanced cleaning requirements? We need to be making sure that we're ordering more supplies. Where are we going to allow employees to bring in food? How will it be stored? What's the protocol for cleaning frequently accessed touch points, such as door handles, light switches, copier buttons, etc.? And last and most importantly, as a part of this checklist, is communicating for confidence. So most important is providing that clear, simple, and unified message from organizational leadership to reassure employees and to address the concerns that many have. While it's important to provide information to employees, it's also important to identify mechanisms for employees to provide feedback and to raise current concerns. So how are you interacting with your employees and how are you seeking that information? Also consider using the sample return to work letter in the guide to provide information and instructions and to be clear about expectations for your employees as they return. If you have additional questions, please feel free to send them to us in the chat. Obviously, returning to the worksite is a big, complex area of consideration. So we provided some high-level information, and the guide is hopefully going to continue to address additional concerns and provides a useful timeline. But with that, I'll turn it back to you, Shannon.
Thank you, Karen. Appreciate that. As we look forward to the HCM philosophy, human capital management philosophy, we continue to recommend and suggest staying connected. Now, as employers, you look at deploying capital, and how does that look? You have your human resources and planning and execution. You have your pension, employee benefits, HR administration and technology, and compliance and regulatory guidelines that you must follow. And how is that? How do you deploy your capital in the current state that you are? As an organization, we do recommend that you are following the laws and regulations, whether they be federal, state, or even local, as we see in certain counties have different regulations than others when it comes to some of this. Look at your business objectives and how they are matching up with your work site and bringing employees back into the fold. What are your needs of your workforce? Are there fears out there that of employees coming back, whether they be protected? Employees are wanting to get back to work and earn a paycheck. So looking at those needs of your workforce as well. I know that we included in this piece, we had a survey for employees as far as what they might need. And then, truly leaning on your benefit advisor, the ones who have invited you to this presentation in regards to that, reaching out to them for any resources that they may have that may help you. There again, the BANS 638 guidelines that we discussed here. We have that full document available to everybody to use. You can co-brand it and use it in your organizations as well. So those are a lot of considerations as we look to stay connected with our organization and our employees. Next, we are going to talk about any questions that have come in, and we've had several come in through our question line, and I appreciate all those who have participated. First question here is, are there any rules set in place yet for companies that will be opening, but the employee does not yet feel comfortable returning, or opposite, the office opens and employees showing symptoms that they can have the COVID virus? This is a question that I've heard from several groups in my discussions. Anybody on the panel want to open up and answer that question?
Hi, Shannon. This is Karen. I feel like I heard a few different pieces of a question there. So one, I think I heard, what if my employee is afraid to return to work? Is that correct?
That is correct, yes.
Okay. I think that there are, there's different guidance that's being put out there. And Stacy, I don't know, before I start to speak about this, do you want to talk about, chime in here?
Sure. With respect to an employee who doesn't want to return to work, and then their sole reason is that they're concerned about coming back, they're scared to come back, they haven't identified any other health reason or family reason, by itself, the fear of not returning isn't protected under any of the federal leave programs, although you do have to be careful. I mean, you could have someone potentially who maybe has an anxiety situation over it. It could turn into a traditional FMLA situation. And then you also have state mandates and ordinances to consider. And I know there's at least one state, New Jersey, that has some guidance out there that does look at it as a payable event under state law if an employee does not want to come to work due to concerns about being in a large group and getting the virus, at least the last time that I checked. So there's not always a one-size-fits-all approach, but that's my initial thought on it.
Thanks, Stacy. So this is Karen again. I guess I'll just mention I participated on a webinar recently, and the chief HR officer for PepsiCo was on, obviously a global company, and he was saying that they were attempting to be flexible and work with employees, at least during these initial next phases of the crisis, and that recognizing that the social responsibility of attempting to take care of employees as best as possible, and that in the long run that not only helps the organization but also helps the community and the larger society as well, if you can be supportive in reasonable terms. And so one thing I know that we're trying to recommend to different organizations is, as you can, work with employees on a case-by-case basis, but that there does need to be consistency and reasonableness, and recognizing that trying to take care of employees is a balancing act with managing the needs of the organization. So I offer that perspective as well. And Stacy, or Shannon, I'm sorry, I also thought I heard you say that there was a piece about what if an employee is concerned because they're showing symptoms. Is that also part of the question?
Yes, that's part of the question, is what if they, are showing like the top 4 symptoms of COVID, and have concerns about that.
Great. And I think that, that takes us back to what Diana was talking to us about the emergency, the FERCRA. I can't get the acronym, but Diana, if you wanna speak to that.
I will speak to that. And if I could just quickly circle back, I didn't want to chime in because you guys were doing such a good job answering that. But one of the first things Stacy said was, if an employee doesn't want to return to work and they don't qualify for any type of protected leave, I just kind of want to circle back to that and elaborate that while in the presentation we did cover employer paid sick leave and we covered FMLA, another one to really just be mindful of and keep on your radar is the Americans with Disability Act. If an employee doesn't feel comfortable coming back to work and maybe they have some type of underlying condition, or I think one of you might have even mentioned like an anxiety situation or something like that, we definitely want to tread carefully, but we want to be mindful that the ADA is at play here as well. So I just kind of wanted to chime in on that. And then going back to the employee who is having symptoms, right now, CDC guidelines are advising that if people have symptoms, so, the fever, the cough, the chills, shortness of breath, any of that, that they be sent home immediately and that they be in quarantine. So, you're going to want to factor in paid sick leave in that as well. But when you're looking at the big picture and the safety of all of your employees, my strong suggestion would be to follow the CDC guidelines.
Yeah, I agree. I would add one point specific about the paid sick leave. The triggers are very specific if you're going to pay an employee under that program and put in for a tax credit to reimburse yourself as the employer. And so sending an employee home who is symptomatic is not by itself a payable event. The employee has to be recommended to quarantine or self-isolate by a provider due to a COVID-19 concern. So if the employee just goes and stays home for 2 weeks, doesn't see a provider, then it's not going to be a payable event, or not see a provider, but at least be recommended that they quarantine by a provider. They don't actually have to go to a doctor, but they have to be recommended to quarantine or self-isolate in order for it to be a payable event under the FFCRA, or the time spent going to get a test for COVID-19.
Perfect, thank you. The next question is for Stacy. Earlier this week, BAN and ALERA shared the ALERA white paper about potential ERISA fiduciary concerns around carrier offers to provide premium refunds, reductions, etc., and how and if a plan that includes employee contributions should share those refunds with employees. We're starting to see carriers announce different forms of refunds reduced. How do you suggest we advise our clients on these issues?
So I had a slide on that. You can kind of take a look at your leisure, but basically you treat it like the medical loss ratio rebate. You look to the terms of your plan. Some plans are drafted to allow the employer to retain the entire credit. Other plans might be silent on it. And if the plan is silent on the issue, the Department of Labor generally looks to what they call ordinary notions of property rights. And so you might look to the employer-employee split to see what portion of that rebate might be plan assets. And then once you determine what portion is plan assets, you have to use it in a way that's permissible under ERISA, like reducing employee contributions. You could provide a refund, you could enhance plan benefits, but essentially I think you treat it like an MLR type of a rebate under the ACA.
Perfect, thank you. Next question is concerning adding a newborn. So, we talked about where they can change coverage and stuff like that. Does an employee have 6 months to add a newborn child to their policy, or do they need to follow the normal, what we consider normal procedures as far as reporting that to the carrier within the 30 days?
No, they get an extension. They could potentially have up to 6 months or more. This is not over yet, but you could have somebody who maybe had a baby born in March. They've not yet had a chance to enroll. The company is still in business, but the employee hasn't gone in. You can imagine all kinds of situations, but yeah, this employee will have time to report that birth of the child and will be able to enroll the child retroactively back to the date of birth. The question brings up an interesting issue, though. What about other change in status or HIPAA special enrollment events, like we getting married or losing other coverage? Those events are only required to be effectuated prospectively. So if the employee were to wait 6 months in that situation, sure, the deadline for notifying the plan has been told, but once the employee notifies the plan, then coverage may be effective prospectively. So it's only going to be retro guaranteed when it's birth or adoption.
Perfect. Next question, in regards to the EFMLA, the 2/3 pay, is that a taxable wage?
Yes. Yep.
Awesome.
So it's going to be the regular wage.
Let's see here. Next question. Are there any rules in place or anything set in place for companies that will be opening but employee does not yet feel comfortable returning? Oops, sorry, I jumped ahead. Apologize for that. Let's see, next question. Just a clarifying question. Employees can stop their dependent care FSA without a qualifying reason?
Yes, as long as the employer amends its plan by the end of 2021 to adopt that change, they can allow a prospective FSA election change anytime in 2020.
Okay. Next question is regards to vacation. We know we've got Memorial holiday coming up. What is best business practices if employees want to take a vacation during the Memorial holiday and it means a travel to other states, say to a state that might be still considered a hot zone?
It's going to, this is Bobby, so great question. So it's going to be about needing to know what are the requirements in the state that they're traveling to, as well as in your own state coming back. There are some states who still have that if you travel outside of those of your state boundaries, that you need to quarantine when you come back or don't come back. I know there are some employers who are taking kind of preemptive measures and requiring that or employees' temperatures be taken before they come back into work if there are no state guidelines to kind of put that that protection around that employee. So I think those are things that definitely an employer, you can ask. Have you traveled outside of the state? Do you have a temperature? Do you, are you showing signs and symptoms? So yeah, it's not only being aware of where you stand today, but where you're going to as well.
Okay. As a follow-up to that, can employers require employees to have their temperature taken before they start work?
So, go ahead.
Yeah, I can answer this, Stacy. Yeah, under current EEOC guidance, employees can be screened for temperature when they come in. There's all kinds of finer points on the details about what information is retained, if any, and what to do when an employee has a temperature or how it can be communicated. But the general rule as of right now is that you can take temperatures, and that should continue as employees come back to work. It's not going to be limited necessarily just to the specific national emergency period, is what it looks like. And now they haven't gone full freight in terms of okaying antibody testing or allowing employers to mandate things like antibody testing to return to work. So you really have to be cautious about what you're asking employees and what you're requiring of them before they return to work.
And if I could just add, you definitely want to be consistent in who you're screening to make sure it's not discriminatory and it's uniform.
Thank you. Next question is regard to FFCRA record keeping. So for the reimbursement purposes, is it still a requirement that an employee put in writing that there is no other person available to care for their children?
I don't think that is literally the requirement, that there be no one else available. I think the employee has to impart that no one else will be caring for the child during the time that the employee is caring for the child. So it's a little bit looser of a standard than the employee attesting that there is no one else available. That's my impression of it, and the group might have more to add.
I think we're with you.
I think there's one thing that we need to take into considerations that, typically employers are very stringent in enforcing their policies and their procedures. And this is an opportunity where really we need to be asking questions. And then we also need to document to support those questions that we're asking. This is uncharted territory for all of us. And so, you definitely want to have flexibility in what you're doing. You definitely still, though, have the ability to hold your employee to providing documentation to support what they're saying. And so it's going to be, again, just extremely important to recognize what does those, what do these laws say that you need to do? And the DOL is, filled with lots of guidance to help direct us in that.
Perfect. Just as a reminder, the slide presentation today can be found in the handout section in the webinar pane, so we can download them there. Next question, can employers require employees to wear masks? And if so, if somebody does not wear a mask, what can an employer do?
So I guess maybe I'll take that first, although can't be all that specific. There really isn't a one-size-fits-all approach. You have to consider, the type of employer, any state guidelines. If you are going to mandate masks, there are certain requirements that have to be met. It may be easier if it's more of a voluntary type of situation. But employers in certain industries where employees are public facing and they're requiring it, there are certain OSHA guidelines that you need to comply with. I don't have them all at the tip of my fingers though, unfortunately.
Perfect. Next question is about the expanded family medical leave and the emergency family leave. Now, initially it came out that it applied to the private sector. Does it also apply to public sector employees?
Yes, it does. It applies to public sector employers of any size. And unfortunately, they don't get a corresponding tax credit like the public employers. So it's a bit more difficult for them in certain cases to comply, I think.
Okay. Next question. Individual works for a school district, and of course, schools are closed through the school year. Question is, what date should we use to have our custodians and maintenance secretaries and other staff to come back to work their regular work schedule?
So, yeah, this is Bobby. There is no set date that every employer needs to adhere to. And I would refer to the timeline that we do have in our resource guide because it helps walk you through those steps of establishing that date. By surveying your employees, knowing, who has requirements for coming back, who has daycare issues, who has school issues, who has, maybe health condition issues, as well as determining then what your work site safety protections are in place and making sure that you have all those I's dotted and those T's crossed. So it gives you those steps by step so that you can work to set a date to have this taken in place. I know for my company, we have different dates across the country that we're looking at, and some of those are established by the specific state itself. And so all of those, again, components and considerations need to be taken, and what's the reasonable amount of time that you can do that in. So you may have a transition, you may bring everybody back at one point in time. So I would definitely refer you to that timeline to help you start to kind of big picture it, and when can you have these check these boxes for these different criteria.
Great recommendation, thank you. Next question, and it might apply a bit beyond just the childhood program, but so individuals asking they're in an early childhood program, so basically that's their business. What if you can only bring back part of your workforce? Are there any rules governing who you can bring back? I mean, so you say you have a staff of 40 and you can only bring back 20. Can you determine or set up parameters of who you can bring back?
So this is Karen. Again, back to this being an organization by organization decision, depending on whatever rules and regulations are specific to your local state and industry. If you have made a decision that you are able to comply with those and function with some portion of your organization staying remote or some portion of them returning back, I do not believe that there is any set number anywhere, and folks can correct me if I'm wrong.
Well, I would just also add to that you also need to look at the workplace itself. So for example, the social distancing guidelines that you would need to be able to follow, can you safely implement those? And are there any, alternative setups that you need to do to arrange for that? So, there's different things to take into consideration. Also, who's needed and necessary for, essentially your essential business practices as well.
And I would just add that, this is so unprecedented that employers, when they're making decisions, they should be able to support those decisions with a business justification. And in this type of situation, if you bring back some employees and not others, I would imagine there's a pretty solid business justification behind that. So just making sure you're being consistent and non-discriminatory and that there's a business need in place.
And I'll just speak for our own organization. This is Karen. We made the decision to not return even when our type of our business is allowed to go back. We've said that we're going to make the decision when it's right for us because of the different guidance and rules that are in place about things like the additional cleaning protocols and the social distancing requirements and the temperature taking and things like that, it may not make sense for us to be back in the office until things are a little more secure. And so I think that that's the type of decision-making process that people are having to go through in terms of is there, to Diana's point, a legitimate business need to be back in? Can you still conduct your business effectively if you are not back? There's a cost benefit and there's pros and cons to all of it.
Great input, everybody. Thank you. Next question is one that really could happen in this whole pandemic is, say you have an employee who comes back to work, they're called back to work, later finds out that they've been diagnosed with COVID-19. What are the protocols with the current employees in the organization, those that may have direct or indirect contact with the employee who was diagnosed?
Stacy, do you want to start with that one?
Well, I think as part of the reopening, businesses are going to have guidelines in place and procedures for dealing with employees who test positive. And, you're going to have to do things like sanitize the area, notify affected employees without disclosing the name of the person who tested positive, unless they agree, unless they authorize it specifically. We've seen that once or twice. But again, there's not necessarily a one-size-fits-all situation. You probably need to notify your local, health authorities if someone is affected in the workplace. I think I would start there.
Good deal. Next question is for Diana. Did you say there is a possible exemption for employers with less than 50 employees under the EFMLA?
I did say that, and there is pretty specific criteria behind that. Stacy, are you okay if I lobby this over to you?
Sure. Yeah, there's a very limited exception from the paid sick leave and the emergency FMLA requirements for employers with less than 50 employees. And for one, it's only for the leaves related to the need to care for a child. So if an employee is taking emergency paid sick leave because they've been told to self-quarantine or they're subject to a state or local quarantine order, any of the events other than needing to care for a child because the daycare provider's closed are not waivable by small employers. It's only the ones for the daycare related. But if the employer has less than 50 employees and it would jeopardize the viability of the company as a going concern because the employee is so critical or they have no other coverage that they have to deny the leave, then they should be able to avail themselves of the exception. It should be documented and signed by an officer of the company. And as you can see, it's a pretty limited exception in the Department of Labor encourages employers to apply it on a case-by-case basis and be very judicious about it.
Perfect. Another question here regarding childcare leave. So the company has a married couple, so both working for the same company, and one spouse is able to telecommute. However, the other employee must work on site. Is the on-site employee eligible for leave?
Yeah, it's possible. The employer of the on-site employee is open. They have work available for the employee. The employee cannot work or telework due to a COVID-19 issue that the daycare provider is unavailable. The other spouse is perhaps working from home and doesn't need to take that on upon himself or herself. You can encourage the employee and say, look, do you want to maybe split time and have your spouse work half the day from home and you come in half a day? You're encouraged to talk with employees and work with them, but that would be an approach for that situation. But yeah, it does seem that could be a payable event under the right circumstances.
Okay. Just a reminder, everybody, that the toolkit that we've been referring to will be sent out after the presentation, so you'll have that to use and co-brand as needed. Next question is regards to FSAs. For an FSA that is not calendar year June, that has a rollover, are they allowed to have the extended amount of time to incur expenses?
Yes, it works in conjunction with the rollover. It's just like the plan year got longer. So they have more time to incur the claims before we even get to the rollover. The rollover is going to happen in that situation after December 31st of 2020. The employer will amend its plan to say for 2020, participants have until 12/31/2020 to incur claims, and then the rollover will apply after that.
Okay. Next one is kind of goes along a personnel issue, but what are the recommended consequences for a salesperson that refuses to follow criteria with regard to in-person meetings and travel, whom then come back and concern other employees with regards to their extended exposure? So basically, you have an employee that is not adhering to social distancing and doing all that stuff, and then coming back and other employees know that they are possibly exposing themselves and then coming back to the work site.
So this is Bobby. So, each situation is going to require looking at, as my favorite lawyer would say, the facts and circumstances of the case that happens. But, one of the things to remember is that, employers, while having the need to, be a little bit more sensitive to what employees are doing and how they're doing it, they're still setting policies and practices in place that need to, be followed. And so being able to take, and follow those, say their progressive disciplinary policy, they need to look to see, does this fall under that, and do they need to practice that? But employees still need to be held accountable and responsible for following company guidelines and procedures. And so employers, while allowing for leeway, still have the ability to follow forward with progressive discipline policies.
Perfect. Next question is regards to somebody who is working, but not as many hours as they did prior to COVID. They can no longer afford their medical or benefit premiums. Is this now okay for them to cancel their benefits? Impact is due to COVID and fewer hours being worked. So basically, their take-home pay is less, and they cannot pay for their benefits.
Yes. If an employee, by itself, the reduction in salary, if that's all that occurs, there's no change in eligibility, there's no change in contribution. A reduction in salary by itself is not a change in status event that would let someone drop coverage. However, under these new rules, if an employer is easing its irrevocable election rule under its cafeteria plan, they can allow employees to maybe change to a lesser plan. They can allow them to drop coverage, although the employee does have to attest they'll be enrolling in other coverage after they drop.
Okay. Another question is in regards to receiving the tax credit, does an employer have to see a 50% or less decrease per quarter? Are they still responsible to issue the emergency sick leave if that requirement is there?
Yeah, I think might be talking about a couple different things. An employer is going to be subject to the emergency paid sick leave rule if they're in business and they have less than 500 employees. Whether they've had a decrease in revenue might be more relevant to Paycheck Protection Act type of situations, but it doesn't impact their responsibilities under the paid sick leave provision, which they can get completely refunded through tax credits. So it is intended to be revenue neutral to the employer.
Okay. For the traditional FMLA, employees must work, of course, 1,250 hours in a 12-month period to be eligible. Is that true for EFMLA?
No, they only need to basically have worked 30 days. And there's even some wiggle room there if they work 30 days in the last 60 days before being rehired. There's some other nuance there, but no, they don't have a 1-year work requirement. It's basically 30 days to be eligible for EFMLA, and people are eligible for the emergency paid sick leave as soon as they're hired.
Clarifying question for the FSA rollover. If a group has a 2.5-month grace period, not the $500 rollover, does that also give them additional time to incur claims?
Yes. Yes, they could avail themselves of this relief as well, whether they have a grace period or a rollover. It applies, and just to be clear, it applies to any plan year or grace period ending in 2020. So the plan's normal grace period, if it ends September 30th, would be December 31st.
Okay. This one is pertaining to, say you've got a security guard who works 1 day a week, Sunday 7 a.m. till Monday 7 a.m. If they're not feeling well and their doctor is concerned they have COVID, are they eligible for COVID paid leave?
Yes, part-time employees are eligible for the amount of time that they would have worked over a 2-week period. So if he works 8 hours a week, he'd be eligible for up to 16 hours of paid sick leave to self-quarantine.
Perfect. We've got time for one final question. Carriers are setting specific enrollment windows for special enrollment due to COVID-19. Does the final rule supersede the carrier's deadlines?
No. You do have to make sure that if you're allowing employees more flexibility to change elections, it is in line with the carrier requirement. If the carrier says you have until May 15th, then that's going to be the deadline to enroll employees.
Awesome. Well, that's all we have time for questions and answers. On the front, on this slide here shows you if you want any more information, you can contact Bobby directly. We do also recommend that you reach out to the benefit advisor who invited you to this event. Again, the guide that we referenced will be sent out after this, as well as an FAQ with the answers to questions we did not get to today. They also, I'll give you a little bit of time. If you want the slides from this presentation, they are in the pane to the right that shows you the slides there that you can download. And with that, I do want to ask the group anything else you want to add in closing.
No, I think we're good, Shannon. We appreciate everybody for attending today. Thank you for your time with us, and we'll continue to provide updates as they are released, and our guide will continue to be updated and available through your trusted benefit advisor who invited you here today as well.
Thank you, everybody, and have a great day and great weekend.
Thanks, everybody.
Thank you.
Thanks.
Next time.